Colorectal cancer is a cancer that develops from the lining of the colon, and as it spreads, it can grow through the wall of the colon and spread throughout your whole body. Colorectal cancer is the third most common cancer in the US and the third most common cancer in Wyoming. And it's also the second leading cause of cancer deaths in Wyoming, just second to lung cancer. The good news is that the prevalence of colon cancer is decreasing, and that's due to the screening programs we have in place here in Wyoming and around the country. So there are a number of risk factors for colon cancer and rectal cancer. Age is one of them, as well as smoking, obesity, low-fiber diet with high-fat diet, and also eating a lot of red meat. It's a misconception that only older men can get colorectal cancer. It is equally seen among both genders, and it is seen in patients with more advanced age. The quickest growing group of patients with this cancer are patients in younger populations. In fact, the American Cancer Society recently changed the screening age from 50 down to 45 because of the rising number of younger patients with colon and rectal cancer. So the signs and symptoms of colon and rectal cancer can vary. It can be totally asymptomatic, or if it's more advanced, you can have symptoms like abdominal pain, weight loss, blood in the stool, bloating, and other abdominal symptoms. Colorectal cancer can be detected in a number of different ways. Sometimes it's just found on a screening colonoscopy, and screening just means it's performed for someone with no symptoms as a way to find an early cancer. Sometimes if someone comes in with the symptoms like abdominal pain or weight loss or blood in their stool, then we do a colonoscopy to look for it. Colonoscopy is the gold standard for screening for colon cancer. It's where a physician, either a gastroenterologist or a general surgeon or a colorectal surgeon, uses a special scope to look at the lining of the entire colon, and you can look for polyps, which are small precancerous growths, or look for colon cancer itself. Early detection is very important for colon cancer. The earlier the cancer is found, the easier it is to cure it, and the less likely it is to shorten your life. The other benefit of colonoscopy is that you can remove precancerous polyps, which are small bumps that grow on the lining of the colon, and those can become cancer, but with a colonoscopy they can be removed before cancer even starts. The recommended screening schedule is different for different patients depending on whether they have a family history of any polyps or any cancers, if they themselves have any history of polyps, or if they have diseases like inflammatory bowel disease or other gastrointestinal difficulties. But for the average patient who's healthy with no family history, the recommended age is 50, although it's been lowered to 45. If you've had a colonoscopy at age 50 and it's normal, then the recommendation is to repeat it every 10 years. But if polyps were found on your colonoscopy, then you should talk to your doctor about doing it more frequently, usually every 3 to 5 years. The prognosis varies based on when the cancer is found and at what stage it is when it's found. Cancers found that are early or stage 1 have a 90% or greater survival rate at 5 years. Cancers that are found later can have less than 50% survival at 5 years. So I can't emphasize enough how important it is to find these cancers early.